So, for the treatment of hepatic encephalopathy, the doctor prescribed a medication to the patient which is lactulose. So, its generic name is lactulose, brand name Inulose, Crystallose, Constulose, and Generilac. So, this medication is classified as laxatives, osmotic, and ammonia detoxicants. So, the patient is prescribed by the doctor of 20 milligram every 6 hours. It is taken per orem, and the mechanism of action of lactulose is that it inhibits intestinal ammonia production by a number of mechanisms. Colonic metabolism of lactulose to lactic acid results in acidification of the gut lumen. So this favors conversion of ammonium to or NH4 to ammonia, NH3, and the passage of ammonia from tissues into the lumen. So indications is used to treat constipation, portal systemic encephalopathy, and hepatic encephalopathy. It is contraindicated to patients with galactosemia, diabetics, elderly population, and pregnancy, or for pregnant women. Its side effects are dehydration, diarrhea, excessive bowel movement because it is classified as laxatives, high blood sodium levels, low blood sodium levels, nausea, vomiting, abdominal cramping, abdominal distension, burping or belching, and gas or flatulence. So the nurse's responsibilities are: the nurse should advise the patient to drink plenty of fluid while taking this medicine. Advice to store in a cool environment. The nurse should explain that lactulose may take 2 to 3 days to take effect. Advise that if symptoms do not begin to improve, or if the symptoms becomes worse, tell the patient to seek medical attention. Lactulose powder can be placed on the tongue and washed down with water or sprinkled onto the food. Alternatively, it can be mixed with water before swallowing. So, patients with constipation should be advised on prevention, such as eating a balanced diet containing fiber, fresh fruit and vegetables, drinking 6 to 8 full glasses of liquid each day, and taking daily exercise. Mix with half glass of water, milk, or fruit juice to improve taste. Patient may take up to this medication may take up to 48 hours to act. Diarrhea may indicate that the dose is too high. Then, the nurse should evaluate therapeutic response like decreased constipation or blood ammonia level. And lastly, the nurse should assess amount, color, and consistency of the stool of the patient.
Another drug used to treat hepatic encephalopathy is the Ativan. The generic name is lorazepam and the brand name is Ativan. It is an anti-anxiety agent, anxiolytics, benzodiazepines, and anticonvulsants. Dosage would be 1 to 2 milligrams per day in divided doses. Since our patient is 54 years old, so she's already an adult. And then the route is per orem. And then the mechanism of action is it binds to benzodiazepine receptors on the postsynaptic GABA A ligand-gated chloride channel neuron at several sites within the central nervous system. It enhances the inhibitory effects of GABA, which increases the conductance of chloride ions into the cell. This shift in chloride ions results in hyperpolarization and stabilization of the cellular plasma membrane. Its inhibitory action in the amygdala helps with anxiety disorders, while its inhibitory action in the cerebral cortex helps in seizure disorders. So, Ativan is indicated for the management of anxiety disorders for the short-term relief of the symptoms of anxiety anxiety associated with depressive symptoms. Ativan is contraindicated to person who is hypersensitive to benzodiazepines or to any components of the formulation, and the person who have narrow acute glaucoma. Side effects would be sedation, dizziness, weakness and fatigue, and unsteadiness. Teaching points and nursing responsibilities include instruct patient to take drug exactly as prescribed and to do not stop it, especially for long-term therapy, without consulting healthcare provider. And then inform patient that he may experience side effects like drowsiness, dizziness, and may be transient to avoid driving or engaging in dangerous activities. And for GI upset, take drug with food and nocturnal sleep disturbances for several nights after discontinuing the drug if used as a sedative and hypnotic. So this includes depression, dreams, emotional upset, and crying. And then instruct patient to report when feeling severe dizziness, weakness, drowsiness that persists, rash or skin lesions, palpitations, edema of the extremities, visual changes, and difficulty voiding. The third drug used for hepatic encephalopathy is the thiamine. So the generic name is thiamine, brand name vitamin B1. It is classified as vitamins or B vitamins. Dosage is 1.5 milligrams per day. The route is per ORM, and the mechanism of action is thiamine combines with adenosine triphosphate in the liver, kidneys, and leukocytes to produce thiamine diphosphate. Thiamine diphosphate acts as a coenzyme in carbohydrate metabolism, in transketolation reactions, and in the utilization of hexose in the hexose monophosphate shunt. Without adequate thiamine, pyruvic acid does not undergo conversion to acetyl-CoA and cannot enter the Krebs cycle. Pyruvic acid accumulates in the blood and is subsequently converted to lactic acid with the potential development of lactic acidosis. Diminished production of NADH in the Krebs cycle. Side effects include warmth, anaphylaxia or severe allergic reaction, skin discoloration, sweating, restlessness, itching, weakness, tiredness of the throat, and nausea. Nursing responsibilities or record patient's dietary history carefully as an essential part of vitamin replacement therapy. Collaborate with physician, pediatrician, patient, and responsible family member in developing a diet teaching plan that can be sustained by patient. And then the nurse should note body requirement of thiamine is directly proportional to carbohydrate intake and metabolic rate. Requirement increases when diet consists predominantly of carbohydrates. Total absence of dietary thiamine produced deficiency state in about 3 weeks. Patient and family education. The nurse should teach or educate the patient as well as the family about the food and drug relationships. So let's go now to our nursing diagnosis. Our first diagnosis is acute confusion related to alcohol abuse secondary to hepatic encephalopathy. Nursing interventions. First is you need to assess and monitor patient's vital signs. And the next is conduct an accurate mental status exam including patient's overall appearance, manner and attitude, and then observe patient's level of psychomotor behavior, mood and affect, and patient's cognition. Then the next is should evaluate the extent of impairment in orientation, the attention span, the ability to follow directions, send and receive communication, and its appropriateness to respond. And then orient patient to surroundings, staff, unnecessary activities as needed, and always present reality concisely because increased orientation ensures safety for the patient. And then limit patient to sensory exposure and provide a calm and peaceful environment, and then eliminate external noise and stimuli because increased levels of visual and auditory stimulation can be misinterpreted by the patient. And the next is be consistent in setting expectations and enforcing rules. Clear and consistent limits provide a secure structure for the patient. Then refrain from forcing activities and communications because patient may feel threatened and may withdraw or rebel. Provide nutritionally well-balanced diet, incorporating patient's preferences. Then encourage patient to eat and provide pleasant environment and allow sufficient time to eat. This will enhance intake and general well-being. And then engage patient in one-to-one activities at first, then activities in small groups, and eventually activities in larger groups. Encourage patient to verbalize true feelings. Avoid becoming defensive when angry feelings are directed at him. And then teach patient to intervene using thought-stopping techniques when irrational or negative thoughts prevail. The third diagnosis is risk for ineffective airway clearance related to seizure. Nursing interventions. Nurse should monitor respiratory rate, rhythm, the depth and effort of respirations to provide a baseline data for evaluating adequacy of ventilation. Ensure patient to empty mouth of dentures or foreign objects and avoid chewing gums if seizures occur without warning. It lessens the risk of aspiration or foreign objects lodging in the pharynx. Then maintain in supine position, flat surface, turn head to side during seizure activity because it helps in the drainage of secretions and prevents the tongue from obstructing the airway. Then loosen the clothing of the patient from neck or chest and abdominal areas for this aids in breathing or chest expansion. Then provide an insert plastic airway or soft rolls as indicated and only if the jaw is relaxed. With these devices, we prevent biting of the tongue and facilitate suctioning or respiratory support. Then lastly is supervised supplemental oxygen or bag ventilation as needed to lessen cerebral hypoxia resulting from decreased circulation or oxygenation secondary to vascular spasm during a seizure. So let's go now to the management of hepatic encephalopathy. First is exclude non-hepatic causes of altered mental function. Consider checking an arterial ammonia level in the initial assessment of a hospitalized patient with cirrhosis and with impaired mental function. Ammonia levels have less use in a stable outpatient. Third is precipitants of hepatic encephalopathy such as hypovolemia, metabolic disturbances, gastrointestinal bleeding, infection, and constipation should be corrected. And then, avoid medications that depress central nervous system function, especially benzodiazepines. And then, patients with severe encephalopathy who are at risk for aspiration should undergo prophylactic endotracheal intubation, and they are optimally managed in the intensive care unit. That's all for our report. Thank you, and God bless.